All right, I'd like to welcome everybody to this evening's injury prevention webinar with Coach Seth and Karen Shanahan of Athletico Physical Therapy. I want to welcome everybody who are attending the live webinar right now, or who will be saying a thank you to those who are going to be listening to this maybe on their next run or taking this in at a later time. We realize that everybody here has really busy schedules, and it's challenging enough fitting in your training in addition to everything else we've got going on. So taking the time out either now or later to take this in, this really important topic that's super relevant to marathon training. We're just very grateful for you and for taking this in. So I'm going to quickly turn this over to Karen, as she's the expert, and she's going to be talking about injury prevention, how we can prevent those injuries over the next couple months leading up to race day. But we do have people that are either on or going to be listening that are training for not only the Chicago Marathon, but the Berlin Marathon, the Marine Corps Marathon, the New York City Marathon, and even some Disney races later this year. So I want to say thank you for taking this in one last time. And with that said, I want to introduce Karen Shanahan. She is a physical therapist, a doctor of physical therapy, and an athletic trainer for Athletico Physical Therapy. Athletico is the sponsor and proud provider of therapy services or physical therapy services to the Chicago Marathon. She's also the facility manager for the Lake in the Hills clinic, which is in the northwest suburbs here in Chicago, close to me. But I've worked with Karen for the last 4 or 5 years, and she is truly an expert and has a lot of great wisdom to share. So I invite everybody to take in everything that she has to say. And there is a little chat box that you will see, that if you have a question, comment, or concern, I'm going to go ahead and type that in. So before we officially turn it over to Karen, if you're on the webinar, can you just type in your chat box, just say hello to make sure that that feature is working. Awesome. Okay, so without further ado, Karen, can you see your presentation?
Yes.
Perfect. Let me go ahead and make that bigger. All right.
Thank you, everyone, for coming in, and thank you, Seth, for inviting me to do this. So everyone's here to, train for a marathon, and, while I put Chicago Marathon on our 101 steps here, it really applies to anything. You do the easy part, you sign up for a marathon, you get involved with a running coach or a running group to help support you. You do a lot of running. Goal is not to get hurt, and then so you can cross the finish line on race day. Unfortunately, when you're doing all this, it is very common to, unfortunately, have running injuries. And what we want to do is minimize those risk factors, and we want to minimize the potential for getting injured. Some common risk factors for running injuries are abrupt increases in mileage. If you've had a previous injury or you didn't fully recover from an injury, if you're less experienced, a new runner just starting out, or if you are on the flip side, if you're pretty experienced and you're being very competitive with your training. Some contributing factors to injuries are age. Unfortunately, as you get older, running injuries do tend to increase. Running shoes. If you wear shoes that are either too old or too new, kind of in that transition period, or they just don't fit your foot type correctly, that can contribute to injury. A higher BMI, a higher body mass index, the more you weigh, unfortunately, it impacts more forces as taking all those foot strides, and that can increase injury. Gender can play a role. Males are actually 1.5 times more likely to be injured than females. The terrain that you're running on, so how hard the surface is, can influence injuries. Inflexibility, if you're just not very flexible, or if you have strength imbalances within your muscles. And then nutrition, not getting enough fuel into your body to help fuel the run and to recover from that. So what we're going to do is we're going to talk about some common running injuries. We'll go over plantar fasciitis, Achilles tendonitis, shin splints, patellofemoral pain syndrome, iliotibial band syndrome, and hamstring injuries. These are probably the most common running injuries that you're going to come across as you're training for distance running. So first of all, if we talk about plantar fasciitis, what this is inflammation of the sheath on the bottom of your foot that typically you tend to have symptoms of a dull ache or almost like a bruise sensation in the heel, and that'll radiate up into the arch. Typically, you have increased heel pain those first few steps of the day, and it tends to be sore at the beginning of a run, but then it tends to improve as you're running a little bit. There's many different causes for that. So you can have like a high arch or a flat foot, tightness in the calf muscles, wearing improper shoes, having an over or under pronation when you're running, and that's when sometimes you run too far onto the outside of your foot or you run too flat-footed. Increasing your mileage too quickly. If there's strength imbalances, and typically it happens when you have like tight hip and weak core muscles. Or it could be a leg length discrepancy where one leg is apparently shorter than the other, or actually shorter than the other, and that can increase the amount of impact that side has on your body as it's going through the gait cycle and as you're hitting and putting each individual foot strike. So treatment for this, you can do ice massage on that area. One good way to do it is to take a water bottle and like a cheap plastic water bottle, fill it with water, freeze it, and then you can roll your foot on it, get a little massage or, at the same time as you're getting the ice, or you can even use a golf ball or a lacrosse ball to massage your foot out. Definitely reaching out to a local running store and getting a shoe evaluation. So you're making sure that you're wearing shoes that fit you properly. Whether it's something that gives extra support for high arches or flat feet, or a little extra cushioning. Potentially wearing orthotics depending on how the foot is fitting you, or if you need any of that extra support. In severe cases, sometimes using night splints or something like a Strasbourg sock can help. What this does is it provides a low load, prolonged stretch for the calf and the plantar fascia muscles. Typically it's worn. Doing calf stretches throughout the day is really important. Working on core strengthening. And then also something like Graston or ASTIM, which are forms of instrument-assisted soft tissue mobilization that kind of help really get into those deep fascial layers and help break up some of the adhesions that might be in there. Next up, if we're kind of moving up the chain, is Achilles tendonitis. And that is inflammation of that Achilles tendon that runs along the back of your heel. It's where those calf muscles attach into the heel bone. Typical symptoms: tightness and pain in the lower calf and the back of the ankle that typically increases after running, and there's possible swelling. A lot of Achilles tendonitis injuries are caused by dramatic increases in training, whether it's increasing the mileage too quickly or running up steep hills that can put a lot of extra strain on that insertion. Tightness and or weakness in the calf muscles can also increase that. Weak hip and core, and improper shoe fit. So what do we do if this comes about? First of all, you want to rest and decrease your mileage or the running intensity for a period of time to allow this to calm down. Using ice, doing some strengthening exercises for the calf muscles, really working on that. If you do like heel raises, really working on that slow controlled lowering phase of the movement. Calf stretches. And the calf muscle is actually made of two different muscles, the gastrocnemius and the soleus muscles. The gastroc is the kind of bigger one that you see. The soleus is tucked underneath. So when you're doing your calf stretches, you want to make sure you're doing them with both a straight leg and with bending your knee to get that soleus muscle and targets it a little bit lower. You want to make sure that your shoes have proper shock absorption. And then sometimes compression sleeves or socks can also help out to give a little extra support and make sure that there's not, any swelling or irritation with that. On the other side of the leg is kind of the shin splints. And this is actually little micro tears, those muscles that attach to the front shin bone. That is typically manifested by like an aching or soreness along either the inside or the outside. Most common is on the inside of the shin. Pain typically occurs at the beginning of the run. It'll often get better kind of midway through the run and then increases again afterwards. Causes of this typically are wearing older shoes, running on hard surfaces, doing training errors like increasing your mileage too quickly, or running on like a gradient surface, overpronation or really kind of flat-footed running, weakness in hip and core. And this actually occurs quite often with like either new runners or returning runners as they're trying to build up their mileage and their body just isn't used to that impact those foot strikes on the ground. Treatment for shin splints is stretching the lower leg muscles. A lot of times it's changing up in different shoes, something that's a little bit more supportive or helps control any pronation that you might have. Strengthening hip and lower leg muscles. Running on a softer surface, so instead of doing, a hard concrete, maybe a crushed limestone can help out to decrease that impact. Really following and abiding by that 10% rule, where you don't want to increase your mileage too quickly. You don't increase your mileage by more than 10% per week. Sometimes you might need to adjust your running form. Some people will be a really heavy heel striker that can increase kind of the braking mechanism and cause increased pain in the shins. Rest and ice are always good, and then the Graston or the ASIM, that instrument-assisted soft tissue mobilization, can really be a help for shin splints as well. Patellofemoral pain syndrome is also known as runner's knee, and this is typically experienced when somebody has a dull, deep ache underneath the kneecap. It's often worse with stairs or running downhill. And a lot of people get a stiffness and tightness in their knee when they're sitting for long periods of time. So, if somebody's sitting at the movies or sitting after a long dinner and then standing up, having pain with that. Causes of this, it could be direct trauma if you fell directly on your knee, but most commonly it's more of an overuse type of injury. Where there is a muscle imbalance in the quadricep muscles. Those are the muscles at the front of the thigh that help control the patellar, the kneecap tracking. Poor flexibility of hamstring, IT band, quad muscles can contribute to it. Overuse, so doing too much too soon or without enough rest breaks. That excessive pronation or really kind of that rolling in of the foot and the lower leg. And weakness in the hips and core. Treatment for the runner's knee is icing. Avoid downhill running as much as possible. Work on strengthening the glutes and the quads. Sometimes taping techniques can help to correct the patellar tracking. Stretching. Sometimes actually increasing your cadence when you're running or having a quicker turnover of your feet can help. And a lot of times that's accomplished by shortening your stride length. For lliotibial band or IT band syndrome, this is a sharp or irritating pain that's along the outside of the knee that typically progressively gets worse throughout the run and can actually often cause you to stop running. A lot of people say, oh, I have knee pain, when what they're actually experiencing is that IT band syndrome, just on that outside of the knee. Causes of this can be kind of just your anatomy if you have a little bit more of a both leg gait or stance. Tightness and weakness in the hip muscles. Again, that overpronation or the kind of rolling in of the lower legs. If there's a leg length difference, if one leg's a little bit longer than the other. Doing a lot of downhill running or excessive speed work can contribute to it. Running on like a bank surface, so if you're on a really curved track or if you're running on a road that has a big arch in it. rapidly increasing the mileage, or sometimes people run with what we call a crossover gait pattern, where their feet kind of almost overlap as they're taking a stride. So almost if you're running on a line and both feet are actually hitting that line at the same time. Treatment for IT band syndrome is rest, stretching, ice, trying to run on softer surfaces, um, really having shoes that have a good heel support or rear foot cushioning, working on strengthening the core and the glutes, limit the running on hills or bank surfaces, and shortening the stride. And the grass center ASIM can also be really helpful. And the last big injury is hamstring injuries, and that can be either strain or a hamstring tendonitis. And typically you get tightness and aching at the back of the thigh. Depending on where the injury is, it might be up high, kind of right below the glutes, or it might be a little bit lower, right behind the knee. Typical causes are weakness. The hamstrings can either be too tight or too flexible, either or can contribute to hamstring injuries. If there's a muscle imbalance, especially between the quads and the hamstrings, if the quads are stronger than the hamstrings, that can cause some strains and tendonitis. Overstriding or really trying to reach out too far when you're running. Doing excessive amounts of speed work or sprinting can cause acute hamstring strains. More of, taking an awkward step or kind of twisting or pivoting when you're running, like if you step in a hole or, you're running downhill and kind of misstep, that can contribute. Not warming up properly and really just kind of going into a long run or speed work without giving your muscles a time to warm up to be ready for the activity, or just simply pushing too hard, whether it's in an individual workout or trying to increase mileage too quickly. Treatment, rest, ice, avoiding doing a lot of interval or hill repeats that can cause increased strain on the area. Doing runs at a slow, easy pace or doing cross training can help with the recovery. Really working on strengthening the core and the hips, and grass center ASIM can help as well. So you kind of are sensing a theme with a lot of these injuries. The treatment is really working on strength training. So most runners like to go out and run, and that's fun for them. They don't really want to do the strengthening work, but it can be so important in both preventing and treating these injuries. So the big thing that strength training can do is it can decrease those muscular imbalances, improve overall endurance, and can help with your running efficiency. All of this can help to decrease injury. And the earlier you work this into your training program, the better typically you tend to do. Because endurance athletes, really the goal is to be out there for a long period of time running and really wanting to make sure that your body can hold up to that. So with strength training, you're really doing more of a lower resistance and higher reps. You're not having to go out and, do a maximal effort, do a squat with 250 pounds on your back. That's not needed. Bodyweight exercises can be just as effective or more effective than doing any heavy lifting in the gym. Ideal is to try and do strength training 2 or 3 times a week and really making that a part of your routine. So incorporating it into some of your easier days or your lower mileage days with running can help out. Some people do like to do some of their strength training on their rest day from running, so that's an option as well. And the key for this is, while you're doing the exercises, is really working on maintaining good form. I'd rather people do 10 quality repetitions with really good form than do 30 or 40 repetitions with bad form. If you're doing the bad form, you're just going to reinforce poor habits, which can actually increase muscle imbalances and can contribute to injury. So really focusing on your form, using mirrors as feedback, or using a running coach or a physical therapist can help with that. So there's a bunch of different exercises that you can do. Some of kind of my favorite ones that really target the hips and the core, which are so important to running to maintaining your form, are sideline clams, where you actually lay on your side with your knees bent and you kind of bring your top leg up and down, almost like a clamshell opening and closing. Lateral band walks, where you put a resistance band around your ankles and you do some side stepping, really focusing on making sure your feet are pointed straight ahead and taking steps to the side. And with that band on your ankles, you can do standing kicks, keeping your legs straight and kicking your leg forward, to the side, and backwards. Working on anything where you're standing on one leg. That is important because as you're running, you're pretty much going from right leg to left leg. You're doing a lot of that single leg stance and you're supporting your weight. So we got to be able to maintain that balance and maintain your core well on one leg. Doing planks, both kind of on your elbows, face down, and on your side, really works on your core strength. So like Russian twists, where you're kind of working on your oblique abs. Doing heel raises and toe raises to work on those lower leg muscles to prevent some of those shin splints, Achilles tendonitis, plantar fasciitis injuries. Doing lunges, and I always say lunges are important to do forward, backwards, and sideways. Runners primarily run forward, which is great, so we want to do exercises that support that. But it's also really important to work on our outside muscles of the hips and your glutes to provide that stability, because we're not doing a lot of side-to-side motions or pivoting motions. So making sure that we utilize strengthening exercises to help incorporate that in can help prevent injuries, provides extra stability when you're on one foot, and helps maintain better running form. Doing things like single leg squats, deadlifts, where you're kind of really working on strengthening those hamstrings, and doing things like bridges. The other side of the form, not only is strength training important, but stretching or utilizing a foam roll can be equally as important. You always want to perform some type of dynamic warm-up, so something like walking or like jogging, some stretches before you run and before you do any of the stretching or foam rolling. So that way you increase blood flow to the muscles in your legs and in your core. So that way they're more adaptable to the stretches. So that's why most of the time we do our static stretching, the stretching where you hold it for 30 to 60 seconds after the run, because you're already warmed up. Key to this is don't bounce. We don't want to do a lot of ballistic motions that can actually potentially increase injury. You can use like a self-myofascial release or trigger point using like a foam roller or a lacrosse ball to really just get kind of a deeper stretch and a deeper release to some of those muscles, especially in the glutes and the IT bands or calves. If you are doing foam roll, doing 1 to 5 minutes per muscle group or per area is more effective than the 30 to 60 seconds for more of a static stretch. So overall injury prevention tips: listen to your body. Your body is going to give you the most keys in terms of what it needs to do, and those little niggling injuries that you might start to feel if you address them early on can be nothing. You don't want to wait until pain is debilitating and it stops you from running to address something or to get help. Follow a training program, utilize Seth, and make sure that you are checking in so that you're not doing things like increasing your mileage too quickly or adding too much speed work. All of those are risk factors for increasing injury. Recognize that rest days are okay and are definitely encouraged. And it doesn't have to mean complete rest where you're sitting on the couch with your legs up, even though that can be great too. But you can do some type of active recovery, something that does not cause any increase in your symptoms. So cross-training ideas like elliptical or cycling or swimming, are all helpful things if you are potentially getting an injury or if you're recovering from an injury. And they're also good just to um, get your body used to a different motion and stress your body in a different way so you're not breaking down. One of the key things I always say is make sure you get properly fitted running shoes. Your feet will definitely thank you as the mileage increases. I always recommend going to running stores because they know their shoes. They know what a runner has to go through. And a good running store will take a look at your feet, take a look at how you're walking, take a look at how you're running, and give you a couple different options and let you try those out. So definitely do this early in the process, and then make sure that your running shoes are still good and have enough support and cushioning. They're not broken down too much for the marathon that you're training for. So you're not scrambling at the last minute to attempt to break in new shoes a week before the marathon. That's not recommended either. You want to make sure you're doing your running homework, stretching or foam rolling, doing your strengthening exercises. Like I said, the earlier at prevention, the better it will be, and typically injuries or risk of injuries decreases. Ice can help reduce pain and inflammation, can help with some of the management of some of these chronic inflammatory or overuse. So utilize that. And I think I already said it earlier, but make sure you're addressing early. If you need to take a few days off just to get back on track, that's better to do early on as opposed to letting things get back where you might not have to take a few days off. You might have to take a few weeks off. The other thing is Athletico offers video gait analysis where you're actually, get on the treadmill, we videotape you running and kind of break it down to see if there's any type of mechanical fault or anything in your habits that may be contributing to a chronic injury or might contribute to an injury in the future. So that's something to think about. So overall, we're here. We do offer free injury screenings at all locations. So you can just call into the clinic closest to you or request an appointment online and ask to physical therapists or occupational will take appointment. Either give you a couple recommendations of a few stretches or strengthening exercises that might help out, or take you into getting in to see a physician if it is a little bit more serious or might benefit from therapy. So at that point, I'm going to just open it up to questions if anyone has or wants any additional information on what I brought up or anything that you guys have. So it looks like Katie's saying, what is a max or average mileage in a pair of shoes, after which you suggest replacing them? Any guidelines you recommend? So that's going to vary a lot on a bunch of different things. So it's not only your weekly mileage, but your BMI, how much you weigh, how much force is being put on those shoes on a daily basis. Ranges out there, say like 300 to 500 miles, which I know is a huge range, but like I said, a lot of it depends on how much force. So if you have a 120-pound runner and a 250-pound runner, they're going to vary. The 120-pound runner can probably be, going upwards in their mileage, where the 250-pound runner should probably be thinking about replacing their shoes at a lower mileage.
Does anybody have any current injuries that they're struggling with right now that you might have questions about? Well, that's a good thing. That's good.
I like it. No, good day.
And this last slide, I think, is great because Karen leaves her contact information, and certainly, I get a lot of emails about how to kind of manage and deal with injuries. But certainly, if you live within an Athletico physical therapy service area, which is super easy to find if you just go on their website, they're now a national company, really, and so you can plug your zip code in and get in there. But I've used the complementary injury screen on a few different occasions, and certainly send clients there whenever there's a question. So it's always best to err on the side of caution. And this is really some great information, just information to have and to know about these really common running injuries that unfortunately tend to rear their ugly heads. I think, and Karen, you can correct me. I think I saw, on an annual basis, an average of over 80% of runners will get hurt, and that's an insane percentage.
It is somewhere right around there. Unfortunately, running injuries can occur at all times, and some of them might be very minor injuries that, you just have to adjust things for a couple of weeks and you're back at it. But unfortunately, a lot of running injuries are overuse injuries or chronic injuries, and the more that you are stressing that area, the more problematic the injury can get and the longer it can take for recovery. So that's why it is so important to address these things early on.
Yeah, and it looks like Katie has a question. She says, I have a weak hamstring on the right leg, not on the left, achy in the middle of the muscle, it feels like. Any recommendations for focusing
on? So there's a bunch of different things that could be going on. Most likely there's some weakness in the hips and the core that can be a little bit imbalanced. One side might be a little bit stronger than the other side, or one side might be a little bit more flexible than the other. A lot of times when you have one-sided hamstring pain with no specific cause, so it's not like you accelerated out of a sprint too quickly or pivoted wrong, that you had that acute injury when it's kind of chronic and achy. A lot of times that you might have like a leg length discrepancy, or your SI, kind of where your pelvis meets, can be a little bit, sometimes a little rotation, or a little bit of instability in that can contribute to the injury. So big thing, trying to correct that muscle imbalance. And I would recommend strengthening the area, doing some foam roll, massage. Other big thing is I really recommend a video so that someone can take a look at your running forms, make sure that you are not compensating for anything in your injury, or you're not doing something with your gait pattern that might be contributing to that continued pain.
Thanks for the question, Katie.
And definitely, Katie, feel free to reach out if you want more information.
Looks like Jerry has a question. Achilles or lower calf muscle has been a problem in the past. It's fine now. What specific things would you recommend to keep it okay?
So number one, I would make sure that you are stretching your calf muscles, making sure that you're stretching both that gastrocnemius and the soleus. So when you're kind of in that with your back straight, that's going to be stretching your gastroc a little bit more. When you bend that back leg, so you kind of bring your knee down a little bit, still keep the heel on the ground, that's going to stretch your soleus. So really making sure that you're doing that on a daily basis. Making sure that you're strengthening not only your calf muscles, so like doing heel raises, but also strengthening like your hip muscles. So a lot of times, if your glutes are weak, you'll try and push off more with your calf muscles. That cause some increased strength. So really doing a lot of hip and core strengthening can help out with that. The other thing too is, making sure you're keeping up on your running shoes and properly fitted running shoes, and you're replacing them, and they're not getting too worn down, so you're not getting a decreased heel cushion that's causing increased impact on there. So
thanks for the question, Jerry. Do we have any more questions of Karen? If not,
thing does come up.
Yeah, go ahead, Karen.
Information there, so feel free to reach out, even if you're not in the area. Shoot me an email, call me. We can talk over things over the phone, or I can help get you directed into the right, next steps to either prevent an injury or kind of help you take that. So
Well, I'd like to thank Karen for joining us tonight. This is all really great information, and unfortunately, at some point along the way, as runners, we're going to experience an injury, and this is just really great information to have as background information, and really how to, um, I don't want to say diagnose, but understand when maybe an injury is beginning to start, and getting into an Athletico or somewhere similar is absolutely critical. And a lot of these places like Athletico will offer complementary injury screens, and those are really invaluable services to take advantage of. So instead of kind of gritting your teeth and abiding by the mantra of no pain, no gain, it's best to, again, err on the side of caution, get in there, get checked out. And make sure that it doesn't turn into a bigger problem than what it potentially is. But and then finally here, it looks like Katie asks any books or online resources you recommend for further information. Anything you would recommend, Karen?
Um, there's so much information online. If you Google, running injuries or strength training, there are so many different things that'll pop up. Um, I don't recall the name off the top of my head of the author, but there's a couple different. The name of the book is like Strength Training for Runner, Strength Training for Track. And like I said, I apologize, I can't remember the author, but those are pretty good resources for kind of a combination of some basic injury stuff and specific strengthening exercises.
And Kathy has a question. Any advice for someone going back running after a meniscus tear recovery without surgery?
So big thing I would say is what caused the meniscus tear. If it was an acute injury from, twisting, pivoting motion, kind of a fall, that's one thing. But if there was something that was the breakdown of your running form, that kind of contributed to a gradual tear over time, then the big thing I would do is correct that running form, really kind of target down what is contributing to it. The other thing is after a meniscal injury, you want to take it slow. You gotta back down in your mileage, back down in intensity, so that you're not causing extra increased inflammation. And then really working on strengthening. A lot of hip and core strengthening is going to be key. And then whenever you're coming back after an injury such as that, I always recommend taking a day off in between your runs so that you're not causing that extra buildup. So, whether it's running Monday, Wednesday, Friday, or however you break it up. And then utilizing non-impact cross training. So things like a bike or elliptical to supplement some of those days when you're a little more sore.
Thanks for the question, Kathy. All right. Well, I think that we're going to go ahead and wrap things up. Again, thank you to everybody who attended tonight's webinar, and thank you to those who will be checking the recording out here in the future. Big thank you to Karen for not only your time, but for lending your expertise. Is, again, like I said, really important information, and it's awesome to have an expert like you share all this great advice and feedback.
Well, thank you for having me, and thank you for listening, everyone.
All right. Thanks, guys. Have a good night.